I just got done doing a phone consult with a patient that was interesting. I thought I'd share with you. So the patient just came back from Saudi Arabia after a work trip and is experiencing dizziness. And he asked if I could help them. So the first thing with the trip, you think, was there a viral infection that is aggravating the labyrinth? So he went to the doctor and they did all the tests and there's no bacterial and viral infection. So we kind of rule that out. So then the next most common thing would be migraines. So we ask if the patient had a history of migraines and they did not. We ask if they had any neck pain. They do not. So we're kind of ruling out vestibular migraines. Then the next thing that we go to is benign positional proximal vertigo. And so that's those crystals moving around. And so we asked the patient, are you having dizziness with head movement? Or is it when you're standing there? And they are not having dizziness with head movement. It's more of a lightheadedness. And so then I was like, okay, so now I'm thinking it could be panic attacks presenting as lightheadedness and dizziness and vertigo. And so usually panic attack vertigo or sympathetic spikes of vertigo tend to be very lightheadedness. And they also tend to be worse at the end of the day and better in the morning. So worse when you're more stressed. And so I asked if the patient has a history of panic attacks, and they said no, but he does have a lot of anxiety and stress. And then I asked, okay, are symptoms worse in the morning or at the end of the day? And they said, no, it's better with rest, worse at the end of the day. So with one, that the presentation tends to be a lightheadedness, one, that the person has a history of anxiety, two, and that's worse at the end of the day. This does seem like kind of panic-induced vertigo. So the treatment protocol would just be improved sleep, owie patches on the feet to help with anxiety, and then breathing exercises, making sure that they're breathing through their nose, doing longer exhales than inhales can be very helpful.